Hi, welcome to Med Medicine with Miss P. Got some good ones here for you this week, and it may be the last for a while because I've got other things to do. But these were interesting to say the least. In that godforsaken box where the patient tells us what we can do to make their stay even better, this person typed in manage expectations around pain. I mean, like, as a nurse, that's one of your nursing considerations, or even plan of care, is to manage expectations, which means the patient's expectations. Because if we cut you, you're going to hurt after. There's no amount of surgery that we can do. There's no cutting, there's no incision or anything like that that we can make pain free. You understand the only medications available to make pain free is heroin, and we don't have any of that. We're all out of cocaine. We don't stock heroin. We don't have meth. We don't have any of those medications. So the amount of medication that would make you 100% pain free, depending on your procedure, could also be deadly. So we're not going to do anything like that. That's not how medicine works. And this particular patient, if I remember correctly, was coming in for like a blepharoplasty. That's just getting rid of the excess skin here. They're usually painless, a little stingy, a little burny, but as far as like pain, where we're giving them fentanyl afterwards, not often. But all right, thank God I don't have to recover that person, because I already know that they're going to be a 10 out of 10 while they're sitting talking to you. We had a patient yesterday. She rolls in, the doctor says, "What level is your pain today?" She goes, "Oh God, probably at least a 10." Just calmly talking to you. She complimented my earrings or my colors or whatever, and I'm like, that's not a 10. Have you seen the movie Payback? Yeah, the anesthesiologist always laughs when I use this analogy. Payback is a 10. When they take Mel Gibson's shoe off and they put his foot on the concrete floor and pop each toe with a hammer, that's a 10. Okay, you calmly talking to us about your cute little outfit or how difficult it is to roll over with a smile on your face, that's not a 10. Have you seen a woman in labor? And I don't mean like her fourth kid where it slides out by mistake, but I mean like a prima gravida. Her first baby, where she barely dilates and effaces, which was me, and 36 hours of labor later, you end up with a C-section. Okay, that's a 10. When you're fairly positive your left ovary had to have exploded, because that's the only reason you would have that bizarre pelvic pain after the baby comes out, that's a 10. Okay, when they give you morphine and you're like, that had to be saline, I feel nothing but Arbor Mist, well, one glass of Arbor Mist and you're drunk, that's a 10. You sitting calmly talking to us, that's not a 10. You clearly have never had a 10. Or you have such a high pain tolerance that you can tolerate 20 and the scale only goes to 10. I don't know. It makes no sense. One person put in that godforsaken box, "I want the best care." Well, that's what we do here. We only give the best care. There's no little bit of care. There's no half care. There's no good enough care. You always get the best care. So whether you're a celebrity coming to our facility, or a family member, or a doctor, oh, he's a doctor. Okay, yeah, not going to treat him any differently, because everybody gets the best care. And that's how most facilities, hospitals, the ERs, that's, we don't treat you any differently. I don't care if you're a crack whore, and I don't care if you're a neurosurgeon. You're going to get the best care. Not better than anybody else, but you're going to get the best care. I'll never understand that. Okay, oh yes. This person said they were allergic to amoxicillin because they had a hard time getting off of it. There's so much wrong with that, I don't know where to go. They think they're allergic to it despite having no allergic reaction, and they couldn't come off of it. They became addicted to an antibiotic. Probably not. I'm going to call BS on that one entirely, but just I got to have my amoxil. THA fibroids, that was the surgery. THA fibroids, that's what it said in the surgery. Does anybody know what that means? Like, maybe it's a real thing. Maybe maybe they meant TAH, total abdominal hysterectomy, because of fibroids, which I'm pretty sure they don't take out your ovaries or your maybe they do, your ovaries or tubes in case you have fibroids in your uterus. I don't think so, but maybe. But this person thinks they had a THA fibroids. That's not a surgery, but all right. Oh, cystoscopy with left wrist cyst removal. They did a cystoscopy with a left wrist cyst removal. So while looking in your bladder, they also took a cyst out of your wrist. I don't, maybe they had an orthopod in there with the urologist, or shall I say urinologist. I have woken up during surgery. Okay, now listen, I'm not going to tell anybody this can't happen or hasn't happened, but when it's a monitored anesthesia care, yes, you will wake up. You will talk to us. We will have to ask you questions and you will need to answer them. That's not you spontaneously woken up during a general anesthetic with a tube in your throat. That's not, I guess it's possible to wake up during general anesthesia with a tube in your throat, but I'm pretty sure like the yanking on the tube or the reaching for the tube and the just the sure reflex that your body will give you when you have a tube in your throat will catch us before you start looking around and hearing things or feeling things. I don't think that's, I mean, anything's possible. I'm not going to tell somebody they didn't have that experience, but this person wrote in, she woke up under anesthesia. Keep that in mind. I was under a local anesthesia and could feel pain, but not move or talk. It was devastating. I don't think I ended up talking to this patient because I would have had to have got to the bottom of that. But unless there's some neurological paralytic, like that sleep paralysis thing, if you're under a general anesthetic and you could feel, then your heart rate is going to notify the physician, the anesthesiologist or nurse anesthetist. The blood pressure surely would alter if you could feel actual cutting, pulling, tugging, or pain. Not to mention the giant tube in your throat. You're not going to have a general anesthetic without an LMA or a ET tube. So I'm curious to know. I'd love an anesthesiologist to explain that to me. I should ask around and see what they say. But a local anesthetic, she obviously didn't mean that, because surely you know that a local anesthetic is what you get like the dentist, or to have the skin spot removed. They localize it and then just cut it off. So I'm so glad I wasn't having to speak to that patient, because I don't. And then they argue with you like, oh no, I know exactly what happened. Okay, I mean, they have no idea what they mean, because I talked to a lady yesterday that says, I have a lot of reactions to anesthesia, so I need to talk to the anesthesiologist. I can't have codeine or hydrocodone or morphine. Okay, none of those are anesthetics. None of those are anesthesia. None of those are going to be given to you by an anesthesiologist. We don't even have codeine in the building. And I kind of had to shut her down real quick and explain that. And she was like, oh, okay. And she was very nice. Okay. I'm sure this isn't what they meant, but it doesn't make it less funny. Occasional patient put in there under pulmonary. At the very end, there's a little box where you can put in like anything specific pulmonary, because they ask you, do you have COPD, asthma, tuberculosis, sleep apnea, use of oxygen at night? Have you ever had a blood clot in your leg or lung? That's all there. So underneath that, there's a little box. And she wrote in, or he, occasional high levels of oxygen saturation during sleep. Occasionally their oxygen gets high while they're sleeping. That's a problem. Okay. I would usually just delete that. I just completely delete it. There's no point in talking. Then they don't even admit to sleep apnea. And then there's a little questionnaire that we ask them anyway. Under surgery, they wrote the name of their surgery was to start their period. I think I did talk to this little girl, and she ended up kind of explaining to me what was going on with her, but she couldn't start her period. Yeah, I do remember. She said she was having like a lot of abdominal pain and all kinds of issues. And they're like, oh, you just are constipated. You just had this, you just had that. She's like, no, seriously, there's something wrong. She finally got her mom to take her to the doctor. And then they had to give her, they had to do something to her that actually allowed her uterus to empty and for her to start her period. But I don't know what, I can't, I don't know. I'd have to look it up to see what that surgery is. I would assume that it was more of like like a hormonal injection you can give, or maybe you wouldn't give that to a teen. I don't know, but it was really interesting. Surgery to avoid removal. That was the name of the surgery she wrote in there. Avoid removal. That's it. That's all it says. You feel my pain yet? You guys understand? Do you feel our pain as doctors and nurses here? It's allergic to morphine. My heart reacts. Oh, under reaction, they wrote heart. It's just a random body part. That is not a reaction to a medication. That's a random body part, but all right. Meds were, oh my gosh, this person, they did it yesterday. I saw one yesterday. I did whenever I wrote this down. They wrote all 20 of their medications in one medication box and just crammed everything in there in paragraph form, and I had to go through there and fix it. It was really painful. Oh, methotrexate. I'm assuming they made methotrexate, but missing some letters there. And this sweet little Hispanic lady wrote in that her husband was 6 foot and 72 inches. All right, we didn't need any conversion, but I think that's what she was trying to do. Cute, but no thank you. Oh, and this other patient quit their spironolactone 10 days before surgery. Because they're having surgery, so he said, I just went ahead and quit everything 10 days ago. That's not how that medication works at all. Oh, my coworker got this and I had to write it down. Lisinopril. That patient's on lisinopril. They wrote in cardiac activity within normal limits. They have this little box where you can write in the last time you saw your doctor or how often you see them. Ideally, it should be the last time, but it needs to be worded better. I'm going to be able to go through this and hopefully fix this little questionnaire a little bit better to make it easier for the patients to fill it out. So we're going to send some emails and see if we can't clean this up. So in that box, it's the reason you see your doctor. So they write in, they're like, checkup, that's not why you see your doctor. You had a coronary artery bypass grafting 6 years ago, so you see them because you have coronary artery disease. That's why you're seeing your doctor. But they never know. They just write in crazy stuff. And this one wrote cardiac activity within normal limits. All right, congratulations. Oh, Bactrim gave me a UTI. She's allergic to Bactrim and gave her a UTI. Not at all possible. Not even a little bit. It's literally an antibiotic. It cannot cause a sterile environment to be any worse. Now, you could have C. diff from an antibiotic because your colon has natural bacteria in a biodome that needs to flourish, but you can't get a UTI from an antibiotic. You can take an antibiotic that isn't helping your UTI, but it doesn't give you one. It's just not helping the one you already have. Oh, yep, that's it. This little portion I'll do next time because that last one is the same as always. Not taking any medications, you call them, they're on 30 medications. Torture, it's freaking torture for me. Okay, speaking of torture, I'm going to have to tell my daughter she's not going to the Valentine's Day dance because she had 2 years to clean her room and it is atrocious. I just want to go in there with a garbage bag and just put everything in a garbage. I don't even think some of that stuff is salvageable. It's not even like garbage, it's just bizarre random crap throughout her entire room and her bathroom. Oh my God, you guys, her bathroom. Her tub won't drain. I don't know what she put in it. I've used all of my super expensive stuff to clean that drain and nothing's happening. I don't understand how one little girl could just be so damaging to her home. Y'all, I know you say empty nest is gonna hurt, but I don't think so. I gotta be honest, I don't think so. I go over to my son's apartment and it too is gross. I find myself cleaning up when I go over there, just like what a mom does. It's not horrific, it's just the same every time. It's the same boxes over in the corner. He's never gonna get rid of. The garbage is full and he can't walk it. 3 paces out to the garbage can. Like, I understand that, and I don't even go in his bedroom. Last time I went in there, I was nauseated for an hour after that, and I had to go home and take a nap. But at least it's his place and not mine. So I'm really looking forward to the empty nest. I'm looking forward to having a clean house. I could have like friends come stay and not be embarrassed. I'm gonna clean that bathroom when she moves out. I'm gonna scrub that bathroom from head to toe, probably repaint, and maybe even replace the floor. And then it's gonna stay that way. There will be nobody to come destroy it. It's gonna be magical. I'm gonna take everything out of the drawers and wipe all the makeup and whatever crap that's in there, the goo slime that she has destroyed. I'm cleaning it all out. I can't wait. It's gonna be beautiful. It's gonna be 6 years from now, so we'll see. All right, same as always, face your fears, forget your failures, follow your faith.